And now I'd like to introduce Secretary Dennis Schrader and Deputy Secretary Bernard Simons for today's presentation on the state of DDA. Good morning to you both.
Good morning. Good morning. It's a privilege to be here today with everybody that's participating in this, and I have the privilege of introducing this session by presenting to Deputy Secretary Bernard Simons a proclamation from the Governor of the state of Maryland. So it's my privilege to present this to you. Let me just read what the Governor had to say. Whereas we believe in a Maryland which recognizes the unlimited potential of all our citizens, including those with developmental disabilities, to live, work, and thrive in our communities. And whereas Developmental Disabilities Awareness Month is an opportunity to recognize the importance of ensuring inclusive environments with equal access to communication, education, employment, housing, transportation, and public accommodation. And whereas Maryland supports those with developmental disabilities to make their own decisions, live where and with whomever they choose, and receive the support they need to be successful, productive, and independent community members. And whereas we are changing Maryland for the better by promoting equality of opportunity, access, and choice for Marylanders with developmental disabilities. We are committed to the promise of a Maryland in which all people with developmental disabilities have the knowledge, opportunity, and influence to make a difference in their lives and the lives of others. So now, therefore, I, Lawrence J. Hogan, Jr., Governor of the state of Maryland, do hereby proclaim March 2017 as Developmental Disabilities Awareness Month in Maryland, and do commend this observance to all our citizens and recognize that our communities are stronger when everyone participates, and that's signed by Lawrence J. Hogan, Governor, and Boyd K. Rutherford, Lieutenant Governor. And I want to present this to you today, Deputy Secretary.
Thank you, Mr. Secretary.
You're welcome.
I appreciate this, and I just want to say on behalf of Developmental Disabilities Administration, we appreciate all the support our governor gives to us.
Absolutely.
It's great.
Thank you.
Thank you. So we'll go ahead and get started, and obviously we've had the proclamation, and so our goal for this month obviously was to create areas and tell stories around people with developmental disabilities and the success stories that people have had. The first week we sent out learning side by side, and we focused on education and the opportunities that people had in their success stories. Week two, we did working side by side, and obviously that the word working implies employment, and there were some great stories about individuals and the way that they participate and have control of their own life and earn some money and buy the things that they want. Third week was community side by side, and what does that mean? It's all about community living and how people participate, not just in employment, but actually be part of their community, not just pass through their community. And the fourth week, we did life side by side. So I want to thank all of those who shared their success stories with DDA. We actually put them on our Facebook page. And I just want to thank everyone for all the support and commitment to all the citizens with developmental disabilities. So we're making the DDA administration work for people in supports. And as I travel around the state and meet with people and many families, they share their excitement about the positive changes that we've been making in our DDA administration. I've also heard some concerns from families that we're moving way too fast and have multiple critical initiatives going on at the same time. And, you know, within our system, it's hard to make a change because if you change only one area, because everything is so interconnected, it makes it very, very difficult for us to only change one piece without looking at a systems change through some type of organizational development as we move forward. So the goal of DD, obviously, should be to have people with DD to live personally fulfilling lives. And that's our goal. Our mission is to provide programmatic leadership in the design and the development of services so that people can live a full life. And our vision is to have people with DD who are in the community of their choice to be included. And as I said earlier, included, not just pass through. So I want to start by highlighting the governor's proposed budget for 2018. And as I said to our secretary earlier, I want to thank the governor for all the support he's given us. And that's evidenced, I think, by our budget this year by looking at the support for transition in youth, for approximately 789 people who will be graduating from school and coming into adult services. Back a couple of years ago, we started an emergency line, not just doing waiting list line, and we have funded to support 131 people in our emergency categories. Our waiting list, as we know, we've had funding that the governor's put in the budget the last couple of years for our waiting list, and that number for the waiting list equity is 36 people. And we actually have a discrete line this year for people who are aging out of social services, and that's the money for about 60 youth. So we have court-involved individuals, as you know, who are committed to DD, and the governor has money for about 27 individuals in that line. Now, some of you know that as we deal with transition in youth and as people graduate from school, we always talk about employment. But there's a whole other area that we need to develop, and that's post-secondary education as an opportunity for people to explore through post-secondary opportunities their talents and abilities and be able to strengthen those and find out what they want to do when they get out of school. Not just from high school to employment, but use this as another avenue for individuals to get into employment and do exploration. As we look at the budget the last couple of years, and as we've had money for emergencies as well as waiting lists, this year we, through the governor's budget, are going to do a deeper dive into our waiting list. And we're going to do that through a new initiative. And we want to reduce the people who are not just in crisis resolution as we've done, but get into the crisis prevention category. And we have 2 new waivers that will be starting next January. And I know people are going to say that that's an aggressive timeline. But, you know, you have to have money in the budget first before you can actually do an application to the federal government to have new waivers come online. So we're looking at January. We're looking at a family support waiver that would provide supports to individuals and families under the age of 22 to do wraparound supports outside of the school system. So that's nights and weekends, and it's personal supports. And actually, we are having a meeting this upcoming Monday with many, many families with the span of ages from who have kids who are either 3 years old up to 22 years old, so that we don't miss what services families are telling us should be in those waivers. So we're looking at having 400 people in that waiver. We are also looking at a community support waiver to have an additional 400 slots for people next January. And that will be capped at approximately $25,000. That will be everything that looks like in our comprehensive waiver that's currently there, minus residential services. So we're looking at an additional 800 slots in addition to the numbers that I gave you earlier around waiting lists and emergencies and transition in youth. So our budget continues with general revenue funding that looks at, we lost something here. So I guess we've got a little technical difficulty. So as we try and get this resolved, okay, we're good to go. Sorry. As we look at the low-intensity supports for individuals, you know, that's about $5.1 million in general funds. There's no match in federal funds with that. And actually, we touch about 2,300 families with that. And as you know, it's capped at $2,000, but all individuals and families don't request that. And then there is a 2% increase in our current budget that is about $20.8 million in funds that looks at the rates and wages for our community providers. So that highlights our budget. Now, as we've gone around the state and as we have on our website, there's basically 5 focus areas that we've been working on with individuals and families, and that's, as you know, self-determination, self-direction, employment, supporting families, and housing. So what are we doing with self-determination? We know that people want to have control over their own lives and want to make decisions about how their resources are used, choose their own supports, and take responsibility for those decisions. So how have we started to promote that? Well, DDA has hired a self-advocate in each region, and I'm aware of only 2 other states that has self-advocates within their DDA system nationally. And so the role of these people is to do mentorship, provide technical assistance, and to advocate for services, as well as providing training on advocacy and self-determination efforts within those regional offices. As you know, we brought in Project STIR from North Carolina, and about a year and a half ago trained 26 self-advocates to be trainers, and we actually contract with people on the go for them to do training throughout the state so that people can learn how to advocate a little bit better for themselves. The other area that we participated in with the self-advocates is something called Health Matters Maryland, and that's a health promotion initiative aimed at improving the health outcomes and health promotions. And this basically works with people with DD to be empowered to take charge of their health by building capacity in their community and to build support networks. This is an initiative that's 12 weeks for doing health promotion, and this group of 6 to 8 people from each provider that's doing this. And at this time, I would like to recognize those providers that are basically engaged in this endeavor. And that's the ARC of Carroll County, the ARC of Washington County, Ken Center, CHI Center, Opportunity Builders, Langton Green, Providence Center, Melwood Horticultural and Training Center, Humanum, and Creative Options. And so as we look at self-determination, we actually have been meeting with about 25 stakeholders on creating a person-centered plan that helps promote self-determination so that people can have their own outcomes as they're driven in what's important to a person and for a person. So we did a PCP, a person-centered planning pilot, and that was conducted in November of 2016 through February of this year. And we received a lot of feedback on how we're going to roll out and how we're going to do this training and implementation. And that it is recommended that individuals in services participate as trainers, not just staff, but the individuals who are in service to participate as trainers in this person-centered process. So the next steps are creating a timeline on how we're going to do person-centered thinking and how we're going to do this training for all case management entities over the next 6 months. And we will be identifying trainers for participants, family members, and service providers on this new person-centered planning process. And so some of you may know that there is a self-determination, a stakeholder group that I believe formed in July of 2016. And our goal is to work with these participants and to create a new robust self-direction framework. You know that we've had consultants come in and give us recommendations on self-determination. You know that we've conducted listening tours around the state, specifically geared towards our home and community-based waiver, but as well as focusing on self-determination. And we did this in September and October to hear what's working, what are the concerns, to get input and recommendations on self-direction on what is the role of the case manager, what is the role of the support broker, and what is the role of the fiscal management service. So this advocacy group we've met with, and they gave us recommendations, and we have another upcoming meeting with them the end of March to review their recommendations and how we proceed, and again strengthening our self-determination and the ability to people to participate and again take more control of their own life. So I want to talk a little bit about the Community Pathways Waiver because we had a lot of information and feedback, and as I said earlier, we had feedback from people who said that we basically were moving way too fast with too many moving parts. So you may recall I sent a letter out not that long ago that said we are not moving forward with Waiver Amendment 2 or Waiver Amendment 3. We were scheduled to do that in the spring and in the summer, but instead, because our waiver application is due, so our waiver was approved in March of 2014, retroactive to July of 2013. Our waiver is good for 5 years, which means in June 30th of 2018, that time frame ends. So in July 1st of 2018, we need a new waiver. It is our expectation, and it's CMS, Center for Medicare and Medicaid's expectation, that we submit an application. So rather than doing amendments now, we'll hold off. We will take our time. We'll get it right. We will get all kinds of input from people. Many of you know we do informal, but we have a formal process period that we need to do to fulfill the regulations for CMS. So we have a 30-day formal window, but before we get there, we need to get it right to make sure that we all move forward in concert to make sure that everybody can either self-control, take control of their own life through self-direction, or ensure that the appropriate services are within our waiver and that they're clear and we have the expectation that they'll meet their needs. I would like to point out this time that we have a staff dedicated to self-direction, and we just hired her, and there was an announcement that out a few weeks ago, and her name is Marcy Schuin, and that we do have an RFP going out to enhance our fiscal management services, and we're doing this with Medicaid because they have the Community First Choice program that also does self-directed services. So we're going to do this as a joint effort within the department. We have employment that's working with individuals, and we want people to continue to look at where they are for excuse me, for competitive, for competition, and to work and become gainfully employed, and to look at where we are about employment and people getting real wages, etc. So based on the feedback, we're in the process of looking at how to streamline our proposed employment and day services. We've had a lot of discussion about flexibility, and our current system doesn't really provide that. So when providers and individuals enter into a service on employment discovery or rehabilitation or community learning or supported employment, it's all showing as where we are with individual discrete billings. We want to change that. We want an individual to have the flexibility to have what we're going to call a meaningful day, and to go in and out of some of those opportunities, whether it be employment services or community activities or community development supports or transitional support, and to enter in and out of those without having people worried about, am I doing the appropriate billing, so that they were focusing on the individual. So what are we doing? We're expanding our technical assistance and supports to our licensed providers. And so the Employment First Leadership Mentoring Program is a technical assistance grant that we have the opportunities to participate in and have providers on monthly webinars to look at where we are. And this is going to run from April to September of this year. And a memo will be going out next week explaining how we're going to do all of this. We've also hired a woman named Stacey Jones to lead the initiative on employment for DD. So now one of the areas that we focused on when we talk about the 5 areas supporting families, and it is essential that we support families because there's a lot of complexity and diversity, and we need to take a look at this and build capacity. And as I said earlier, we're going to step up a family support waiver, and we need to work with families. And many of you know that we have a point person that we have hired back a while ago, Mary Ann Kane-Brushy, to lead that initiative. And we actually are partnering with the Maryland Developmental Disabilities Council and the ARC of Maryland so that we can start working on the Maryland Community of Practice and the life course framework that many of you have seen. And recently we've done presentations across the state. I believe we've done 3 of the regions, and the 4th region, I believe, is upcoming and scheduled. So charting the life course is extremely important. We actually know that the Maryland Division of Early Intervention and Special Education is also using that same life course. We've seen that in some of their presentations. So again, we're looking forward to an annual event for supporting families that's been scheduled for June 14th of this year, where we will unveil a 3-year strategic plan. So supporting families waiver, I've already talked about, and we need to figure out what we're doing with that upcoming meeting this Monday the 27th, and what does that look like for people for after school nights, weekends, education for families, and you know where they are as far as do they need help. I mean, our waivers usually focus on the individual who's in the waiver itself, but this is going to be a little bit of different focus. So it's going to look at the individual and the family as a unit. So our other area that we talk about is housing, and where are we and people having their own home. Currently, as you know, our system and the way our regulations are written, we have assisted living units and we have group homes, and obviously the way the regulations are written, that is for providers to either own the home or lease the home. We want to give people an opportunity to be able to have their own housing, and that will be a new service that we have within our waiver as we rewrite the application and submit it to CMS in January. So in the meantime, individuals, obviously we use Money Follows the Person to bridge subsidy for individuals, and individuals obviously, and we know we have some folks in this now that receive Section 811 Project Rental Assistance Program, and we also know that the Harry and Jeanette Weinberg Foundation does affordable rental housing opportunities for people with disabilities. So again, we look at where we are with subsidies, and many counties participate in this, from the East Shore to the West, such as Worcester County and Allegheny County, City of Hagerstown, Frederick, Garrett, Hartford, Howard County, etc. So many counties engage with that. So currently there's 17 participating units that they are in Dorchester, Hartford, Montgomery, Prince George, Somerset, and Wycomico that are funded through the Harry and Jeanette Weinberg. So for more information, I would suggest that you contact your coordinator of community services. And as I said earlier, supported living is something that we will be adding as a new waiver service definition in January. So we remain focused on these initiatives, and now you know that we've been doing this. We've been talking about this now for the last couple of years. I want to focus on a couple of updates of where we are as we move forward. So many of you know that in legislation in 2014, DDA is to move from a prospective payment where we pay providers on the front end to a fee-for-service system. We also know that our current system, PCIS2, cannot support moving from the current system to a new system. So that means that DDA needs to develop a new IT system for payments to replace this legacy system. And it will include functionalities for our regional office, case management, person-centered plan, and self-direction. And so phase 1 was initially scheduled to start this July and phase 2 the following year. But due to having some technicalities and wanting to better align our waiver service renewal along with our infrastructure, we made a decision to postpone this for a year. So our implementation for phase 1 will be July 1 of 18, and then we will do a go live 100% of what we are doing in July 1 of 2019. And this will enable the development of additional functionalities that we have and give us the opportunity to provide adequate testing, training, and transition, because this is a major endeavor that we're doing. We are changing our payment systems. We are changing our whole systems the way our providers will bill for rates. We are changing the way our case managers will be moving forward. And we have made a commitment that the providers in their current systems will be able to upload into the new system. And we need to build that in as we move forward. So that was one part of the legislation to build on rates. The other part was we need a rate setting study. So we've hired, and many of you providers and hopefully individuals and families have heard that we've hired an independent provider, JVGA, who is out of New Mexico, to work with the providers to establish new rates, and that we have established quality groups to work with these providers to take a look at the rates to make sure are the service definitions correct, and is the rate that we are proposing to pay for those services adequate. So we have those quality groups composed of self-advocates and family members, as well as interaction with providers. It is our hope that we will have this results by this summer. Now, we initially were supposed to have this earlier on in January, but we wanted to make sure we got it right. We have had JVGA contact some of the providers to make sure that they were totally understanding exactly what they were looking at from the provider ledgers, to make sure it was clear and that we had 100% of what we were looking at in moving forward. So one of the areas that I was concerned about, and I did share this at a meeting about a month or so ago, is that we are looking to deal with our workforce. And individuals and families and providers have concerns about turnover with direct care. Everybody is recruiting from the same pool, whether it be behavioral health, home health services, through Medicaid programs, or our DD services. So we all compete for the same folks. There is a limited pool. There are more and more people who are coming into supports and services, whether people are living longer and aging, and so we're seeing more of a gap between the number of people in services and supports and the number of people who are in our workforce. So one of the areas that the providers have done, and when legislation was passed a couple of years ago, was to take a look at the wages for direct care. And we think that's a good thing. So if we can, have wages, then it's good to stay ahead of the local eateries and who can take our folks. So where we are with this is I'm proposing to create a structure that we would have a career ladder for direct support professionals. And we would have to actually fund that. So what would that look like? So you come into work, you're hired, you go through your background checks, all of that stuff. You get hired, you come to work for a provider, and you start out as a direct support professional 1. And what does that mean? That means basics of what we have. That is, you have a high school diploma or a GED, and all of the basics that need to go along with that, CPR, first aid, etc. So while you are there working as an agency, in an agency, there is an opportunity, rather than you leaving and going someplace else, that if you go back and get some type of credentialing, and that could be from an academic perspective of an associate's degree, or you are looking at American Sign Language or bilingual, and we need to get a group together to see what does this look like and what are the actual skill sets that we are looking at. So if you go out and do those things and then become credentialed, you could move to the next level and be a direct support professional 2, and we would increase your wages. And then we would do the same thing for a direct support professional 3. So we are actually building a career ladder to help assist us to stabilize our workforce, and we are building this into the rate study, and we will, as I said, pay for this as we move forward so that we have a more competent workforce and a stable workforce. Now, questions have also come up about where are we with our behavioral support services. And we have had a letter that went out about a week or so ago, and we basically have 4 contractors around the state to provide behavioral support services on evaluation and writing behavioral supports. So in the West region, that's the ARC of Washington. The Southern region is the ARC of Southern Maryland. Eastern Shore is Somerset Community Services, and the Central region is Humanum. And so what we are looking for is to transition from where we were with one contract and to encourage providers who have individuals in their supports and services to become licensed through DDA to have the appropriate staff who are either licensed psychologists or licensed behavior analysts to provide those behavior supports within their agency. And so we intend, as we go through this current transition, which is effective April 1, right around the corner next week, to transition from Humanum to those 4 entities, and we've met with those entities last Friday, and we'll continue to work, but we are looking for our system to transition, not just to have 4 entities, but if you are an agency in the East region, as an example, and there is currently one provider there that I just mentioned, and you decide that you as an agency want to hire a licensed behavior analyst, and you have 30 people in your agency that need behavior support plans, we encourage you to do that, to become licensed and to apply through the application that's on our website. So again, where are we with our restructure? We're looking forward to, as I mentioned, staff development, looking at direct support professionals, building where we are a competency workforce, whether it be with the providers, as you currently do, but giving different opportunities through career ladder, or basically looking at where we are in filling our positions within the regional offices. We have filled key positions in our southern region. We've had the opportunity just to hire a brand new regional director on March 1st, Lisa Ott for the central region. Stacy Jones was hired as our employment and career service coordinator, and we hired Dr. Smalls to be our statewide coordinator to work with our targeted case management entities and community services. So Next steps, we will be hiring someone to do communication. Actually, that posting for our position closed yesterday. We're looking forward to working more with our website, social media, and communications. So DDA will be having someone that will be doing a lot of contact and a lot of communication and working with you to make sure that we are not doing something and it's not being communicated. We need to be communicating, we need to be transparent, and we need to make sure that that person who's doing communication is not just communication going out, but also taking communication back from you and hearing exactly what your concerns are so that we can do adjustments to make sure we're meeting everybody's needs. We are here to serve, and that is the role of the state, is to serve, to make sure that we are a good servant, to make sure that you are getting the appropriate services that you as individuals and family members get. The last position we're getting ready to hire is a statewide clinical director, and that person will be a board-certified behavioral analyst or PhD psychologist that will work with the regions and try and build additional capacity around clinical supports. So to further support our priorities, we've been engaged with the DD Coalition, and that DD Coalition, as many of you know, is People on the Go, the DD Council, the ARC Maryland, Disability Rights, which used to be MDLC, and MAX, which is the Missouri Association. And we've been working with these individuals around what does our eligibility look like and that criteria, and to enter into DD services. Many of you know our statute has not been updated since it was written in 1986, which is the last update. Many supports and services and definitions and what is considered cutting edge have changed since then. So we need to go back and take a look at where we are with updating our statute. We are looking at our waiting list and all of everything we're doing there. We know that we have a waiting list that deals with 3 areas: current request, crisis resolution, and crisis prevention. And we know that some folks who fall in some of those crisis prevention and current requests are a very large number. I think we can do a better job and need to go back and take a look at where we are with the acuity level of some of these individuals and how this works. We've hired an outside consultant to work with us. We've engaged, again, with the DD Coalition, and I want to thank them for their leadership and the way that we are moving forward. So we need to change our statute. We need to update our regulations as we change our statute. Our statute should be at the 50,000-foot view, and then the interpretation as we move down our regulations, and then step it down even further to our policies and procedures. So again, our new initiatives are our family support waiver, as I mentioned early on, that the governor supports in the budget for 18, the community support waiver, the way we move forward with our staff stability and looking at our so I think I made a mistake and I need to go back and correct something, because I said my last state that I worked in, Missouri, not Maryland. So I apologize to Max, since you are Maryland Association of Community Services. So I apologize again for that. So one of the other areas that we're looking at is, outside of staff stability, is accreditation. And, you know, we're only as good as our quality enhancement system, and accreditation is one piece of quality enhancement. So one of the areas that we will do is, rather than requesting each individual provider to go out and work with either one of the accrediting agencies, whether that be CQL or CARF, etc., we as a DD agency should be accredited. and then you, as working with us and contracting with us, will fall into line with accreditation through your policies and procedures and practices. So we will start that. It probably will take us a good 5 years to get everybody on board. It's not an easy lift for us. So we will continue to have dialogue and engage with everyone on that. So again, next steps, a comprehensive waiver, finalize, public comment, formal 30-day, and then submit in January so that we have a good 6 months to engage with the Center for Medicare and Medicaid Services for our new waiver to start in July 1 of 2018. We need to look at our new waiver and both waivers on development and public comment, and what do those service delivery definitions look like to meet people's needs. Our eligibility and waiting list changes as we meet with the DD Coalition, and then bring that out and ask for additional public input. Where we are in strengthening our self-determination and our self-direction in changes, and completing the rate study and seeing where we are with that as we move forward. In closing, I'd like to thank all the self-advocates and their families who put their trust in DDA. This transition of a culture to move a whole service delivery system to assist Marylanders with DD to lead a personally defined and fulfilling life. While we have a lot of work to do to finish in front of us with self-determination and with determination for all of us, we can address all of these challenges and position the state for long-term growth as we move forward with our new waivers, with self-determination, with changing in housing, etc. We can afford to have people with developmental disabilities and their families in a seamless service system that we need to be responsive to everybody's needs and assist them with personal outcomes. So I look forward to moving around the state, listening to everybody, getting as much feedback as we can, and basically implementing DDA's vision that people have full lives in the community of their choice where they are included, participate, and are active citizens. Thank you, and thank you for the opportunity to do this presentation about the state of Maryland's DDA.
Thank you. I think it's time to end the webinar. We are collecting questions. I will leave it open for 30 more seconds. If you have another question, please type it in the question box. Okay, thank you everyone for participating, and we're going to end the webinar now. Thank you for attending.